Welcome back to Good Morning El Paso. It's 6:16. Frontline healthcare workers are being pushed to their breaking point as hospitalizations have skyrocketed this month. We want to give you a better perspective of the crisis they're facing, so we're now joined by Dr. Ogachika Lozi. He's an infectious disease specialist and the chief medical officer at Del Sol Medical Center. Dr. Lozi, thank you for being here.
Morning.
So, Dr. Lozi, I think so often we get bogged down by numbers. We just mentioned it earlier, 908 hospitalizations. You see the faces, you learn their names, you oftentimes become close with patients. So what is it like for you dealing with this health crisis right now?
I think where we are right now is we're just tired. I mean, I think the city's tired. It's not, when I say we, it's not me or the healthcare workers, but they are. The city's tired. And I get when people are tired of restrictions, they're tired of limitations. But I think, like I've been sort of trying to tell people, that all the numbers, whether it's 1,300, 1,000, those are human beings. They're, like I said, the 30-year-old that came in the other day, or the gentleman that was asking for a cup of Sprite before he got intubated, maybe his last cup of Sprite ever. And so that fatigue, having physicians and nurses walk up to you and literally break down crying because it's tiresome and it's just painful to watch so much human tragedy and death.
Can you take us what it's like through a day in the COVID unit? What are you seeing right now?
So I think walking through any COVID unit in the hospital it's sort of eerie. It's almost like one of those movies where you're all by yourself on this empty street and you're wondering whether the world is coming to an end. You walk through the hospital and there's nobody in the hospital because we don't allow visitors get into the hospital for their safety and for our team's safety. You go into the COVID unit and people would expect it to be like a movie where there's bells and whistles and a lot of chaos everywhere, but it's actually really quiet. The healthcare teams are doing their job, they're in their PPE. And because you're in PPE, you don't have a lot of opportunity to talk, right? And so they're going from room to room and just taking care of patients. And I think that's really the key. And so it's really hard to explain unless you've seen it. I think it's important for the community to understand that it's not someplace that they ever want to wind up or they want their families to wind up. It's not to say that we don't believe that we're giving the best care possible. I mean, we're fully equipped and ready to do that, but this is something that you want to avoid if you can.
Dr. Lozi, we've been saying it for months now. Wear your mask, maintain your distance, yet we're still seeing this massive, massive spike. What message do you think isn't getting through to people?
I think a lot of times people just don't see it affecting them, right? This is actually the ultimate sort of, how do you become selfless? How do you become a community? How do you actually work the words El Paso strong? Is it just a hashtag or is it something that actually means something? And so whether you're young, middle-aged, and you're going out, you're in a bar, you're in a crowded setting, and it doesn't have to be bars or restaurants. They get the sort of boogeyman status, but it could be anywhere. It could be those family gatherings. You got to remember that your circle is interacted with 10 other circles, right? And because it is, any interaction you have potentially gives a risk. And so whether it's your parents, your aunts, your uncle, grandmother, grandfather, I think we do need to take a step back. I think it's also important to realize that at the end of the day, there's not going to be a political desire or will to do some of the things that people are asking for. And so the community is going to have to do it. And we've seen that in other cities as well, where the politics didn't catch up to the human desire to stay safe. And so eventually the community will slow down. The unfortunate thing is whatever we do today will take at least 4 to 6 weeks to kick into effect. And so we're going to be dealing with this healthcare crisis for some time.
We're in it for the long haul. Dr. Lozi, thank you so much for your time. We really do appreciate it.